Wonderful Monday. Well, glasses and contacts can certainly correct vision, but LASIK surgery is like having naturally perfect eyes. But the word surgery can make people nervous. Our next doctor says, keep your knives for a good steak because this surgery is blade-free, but it will help you see. Here to clear up some misconceptions about LASIK, please welcome ophthalmologist and LASIK surgeon, Dr. Colby Stewart.
Thank you, Deb.
All right, you're welcome. The eyes are one of those things that you can have perfectly great sight at one point in your life, and then things can start to go south.
That's right. I mean, a lot of times you'll see people, especially when they get into the years of college and after 18, when you use the eyes a lot, you can become a little bit more myopic, a little more nearsighted, meaning that it's harder for you to see off in the distance, and you're going to need something to help you, glasses or contacts.
Yeah, and there's certainly one of those things that we can outgrow. It's like around like 1900, the average age of people around the world was between like 40 and 45 years old. So your eyes held steady, but we're living well beyond that today. So other things can happen to our eyes as well.
That's right, and that's a normal progression called presbyopia, which occurs when we're after 40. And there's a reason why when you go to the department store or drugstore, you'll see all these glasses there, and you don't need a prescription. Those are just magnifying glasses for people that are over 40, and they realize that, oh, I'm holding stuff further and further out, and then they need some help for the up close stuff, and that's going to happen with everybody that's over 40 at some point.
All right, LASIK surgery has been out for quite some time, but now in the beginning there was that, was it laser keratotomy? That was a little bit different than what we're talking about today.
Well, there was RK was kind of the first thing, was invented in Russia. We were making little incisions with a freehand with a diamond blade, and that changed the shape of the cornea. And then the next step was LASIK, and which is making a flap in the anterior part of the cornea, and we take that flap back. It sounds horrible, but it's really
But it's not. And I mean, I had it done. It took just a few minutes.
Right.
And literally, I got up, no pain, anything, and I could see, like, I was like, oh my, I mean, I could, like, see from here to Washington, D.C., I could see. I mean, it was just like, oh my gosh, hello, Mr. President. But again, when you say surgery, a lot of people still have questions about it. So we have some folks in our audience today who would like to ask some questions, and we have some email questions as well. Let's start with Kelly. Good morning, Kelly.
Hi, good morning.
And what's your question?
So I've considered getting LASIK, but I'm nervous because I've always heard that it cuts the eye. So how does that actually work?
All right, she's wondering about that cut in the eye, right?
Well, there's really two big refractive procedures that we do right now. One of them is called PRK, which is just laser on top of the cornea. So we actually take the laser and put it right here on the top of the cornea. The other way is to make create a flap, which with a flap on the cornea, we reflect it back, we do the LASIK, and then put the flap back. You do have to make some type of incision on the cornea. In the old days, I say 10 years ago, we were using a blade. And now everything's done with the accuracy of laser. Your eye's numb, can't feel anything. We put a little
You have no idea that what's happening.
That's right.
Yeah.
You can't. A lot of patients worry that they're going to see me coming at them with sharp instruments and all this stuff, and they won't be able to, blink their eye. We put a little speculum in the eye, so there's nothing that the patient can do to mess things up once we get there.
Right. All right. This email question is from Chris, and it says, I have astigmatism. Am I a candidate for LASIK surgery? We know so many times people are told, oh, you have an astigmatism and you can't do this. I had a pretty severe one and did it, and it was fine. Well,
that's the number one thing that I think when people talk to me, they say, oh, I wanted to have LASIK, but I couldn't. I've got a bad astigmatism. And we've really been able to tackle astigmatism even back in the beginning, in the early times of LASIK. So astigmatism is just another, without getting too technical, it's just another part of the refractive error that a patient can have that can be corrected with LASIK.
Yeah. All right. Brian, good morning.
Hi. Good morning. Dr. Stewart, how much would my vision really improve after getting LASIK surgery?
That's a good question. Whatever we can get you to see when you're wearing your contacts, let's say with your contacts on or a pair of glasses, if I can get you to see 2015 or 2010, which is really, really good.
Yeah, that's crazy.
Then that's what we're going for with LASIK. If some people have a lazy eye, you hear this from time to time, and let's say that eye can only be 20/40. Well, whatever. The best we can get it with the contact, the best we can get it with the glasses, is what we would be expecting to get after LASIK.
Yeah, Washington, D.C., my friend, I'm telling you, you can see it. All right, Amber, hi there.
Hi, good morning. Dr. Stewart, I was wondering, following LASIK eye surgery, around how long should I expect to wait until I'll be able to see to the best of my ability?
Okay, well, most of our patients, when they sit up from the procedure takes about 6 minutes to do. Right when you sit up, you can tell a difference. And it's a little bit blurry. I mean, people can read the clock from across the room, but they'll tell you that the numbers are a little blurry. About 3 or 4 hours after that, the vision starts to clear up. And the next morning is usually where you see the biggest, I call it the wow factor, when people get up and they come into the office. Oh, it's like I was seeing an HD. I could see the little leaves on the trees.
But it's true. The colors are more vivid, everything. And I got up and tried to take my contacts out because I was like, surely I slept in my contacts. I was like, no, wait, I had LASIK surgery. But everything is so much more clear, and you can't believe you didn't do it a long time ago.
Right, and you hear that a lot. But there is a little bit of fluctuation throughout that week. You know, some people will get a little bit of dryness and stuff. But usually after the procedure the next day, patients can go back to their regular activities. They can drive a car. They can do a little extra light exercise. So
yeah,
it's
funny, and you get used to it, because I kept trying to push up glasses also, and I was like, wait, I keep poking myself in the nose. I don't wear glasses anymore, right? All right, this email is from Cecilia. What's the difference between LASIK and cataract surgery?
Oh, okay. LASIK is the reshaping of the cornea, which, again, let me just go back to my model. And this is the cornea. This is what you would actually put your contact on. And a cataract is behind the pupil, and it's just this lens here. We're all born with is clear, and it gets hazy and turns its name into a cataract. Well, we can use lasers now, which is relatively new in the last couple of years, where we can break up the cataract using laser energy and go in and remove the cataract and put a new lens in. So the two surgeries are completely different. Cataracts, everyone's going to get a cataract at some point when they get old enough, and when it's visually significant and it's not correctable with a pair of glasses, then that's when we do laser cataract surgery.
And the number one question that people ask me about, they go, what if they make a mistake? I'll be the one they make a mistake on. You've done thousands of these.
Yeah. I mean, this procedure, you know, these procedures are extremely safe, especially now that we're using the accuracy of laser. But they are surgery, and I mean, you want to make sure that people are good candidates. We run them through a free consultation, looking at all the different types of information to make sure that someone's a good candidate, and it's not something that just comes in, oh, this is your prescription?
Yeah.
Oh, good, we'll put you under the laser. No, we do a very, very thorough check to make sure that people are good candidates.
All right, thank you very much. Dr. Stewart has a special offer for Great Day viewers. $1,000 off blade-free LASIK. $1,000 off blade-free LASIK. This includes the visit, the procedure, post-operative care, and enhancements. Just mention Great Day Houston. To get in on this special, call this number, 713-358-4340, 713-358-4340, and you can learn more about Dr. Stewart and LASIK at stewartlasik.com.